Hi everyone, Dr. Emmy from Pain Free and Fit. Today we're going to be talking about the most dangerous spondylolisthesis core exercise mistakes to avoid while performing front planks. Hope you enjoy. So there's a lot of people out there with spondylolisthesis of the lower back, L1, L2, L3, L4, L5, and S1, grades 1, 2, and 3, that are performing front planks for the abdominals to help with their spondylolisthesis pain. Unfortunately, there's a lot of mistakes that go on with that you should be aware of so you can actually avoid strengthening dysfunction and more mechanical irritation in your lower back. Front planks, of course, are designed to develop the abdominals, the ability to hold the tailbone under or posterior pelvic tilt, raising the pubic bone up and decreasing the arch in the lower back, and creating a forward slumping or crunching motion of the rib cage. The reason that spondylolisthesis sufferers often choose abdominal work such as front planks is because many cases of spondylolisthesis are aggravated with extension. If you're leaning the upper body backwards or if the tailbone is coming up and increasing that arch in the lower back. Unfortunately, doing a front plank by itself is only the beginning of proper rehabilitation for spondylolisthesis because there are other planes of motion besides front to back or anterior to posterior motion that affect spondylolisthesis pain, that affect the amount of the facet joints in terms of their compression, disc fibers, ligaments and tendons and muscles that get irritated. Two of these are the lateral flexion or side bending motions and rotation motions. If you haven't yet done an analysis on yourself, and of course a more full analysis is available at the painfreeandfit.com website to figure out how your body mechanics relate to your spondylolisthesis pain and the mechanical stresses that go into your spine, you can do a simple test at home by standing on one leg. If you stand on one leg, you're going to look for two things. One is a rotational component. Many people, when they stand on one leg, they'll notice that the hips naturally sway and the torso sways to one side as opposed to being straight. This will happen especially if you have a posture tendency such as an external hip rotation posture tendency, where when we stand on one leg, that hip external rotation will take over when the foot is planted and the pelvis will turn away, creating external rotation in the hip. People that like to cross their legs, people that like to walk with one leg out more than another, this pattern will happen. Typically, with a good symmetrical stress on the body during front planks or any exercise, you should have your body aligned. But if you notice when you stand on one leg that your hip naturally wants to rotate a little bit to one side, and you can check this from side to side, you'll notice one side will naturally rotate a little bit more. You want to identify that because that's the same thing that's going to be happening in any exercise, including front planks. Now, think about this for a moment. If you naturally have a tendency to turn or twist your body to one side, and you're stronger with your latissimus, your erector spinae, your abdominal oblique muscles in going that way, that's only going to happen when you go into a front plank. When you're holding a front plank position, those same muscles that are dominant are stronger than the opposite side to go want to contract. So by doing a front plank and trying to strengthen your abdominals, you're inherently strengthening that dysfunction. You're strengthening more of that tendency to twist, so you have to avoid that during your front plank. The other thing that you can check is a lateral side-to-side rotation or a lateral flexion motion. When we stand on one leg, you'll notice that many times one hip will slightly come up. And if you put your hands on top of your hips, you'll feel as you stand on one leg versus another, one hip may come a little bit more upwards towards your shoulder than the other side. There'll be a natural tendency to sag. You can also watch this as you're walking. As you take a step, many of us hip hiker have one hip that comes up a little bit more than another. You'll also be able to tell if this is an issue for you is if when you stand on one leg and you keep your thumbs at the bottom of your ribs on both sides, right and left, you'll notice that sometimes a rib cage will have a tendency to depress or fall down on one leg versus another. So you want to identify if you do have hip hiking or side leaning lateral flexion tendencies of the mid back, the thoracic spine, because inherently if you're stronger in going to one side, and again, this happens because we all have our favorite sides, our stronger sides. Some of us sit slightly to one side. Some of us move. Some of us are stronger with our latissimus muscle, our erector spinae, our abdominal muscles on one side. And if we have a tendency to twist or tilt to one side more than another, that asymmetrical development is going to come out during our exercises. You want to avoid this because during front plank, what's happening is as you get into that position, if you notice and have a critical eye or have someone watch you, when you're really holding the position, and especially later on in the set when you're trying to get those last few seconds and build your progress, your stronger muscles are going to take over. Why? Because they're stronger. You've built the endurance and the strength of them. So in that position, what will happen if you have a tendency, let's say, to hip hike on the right side, is you're holding a plank, that hip will be tensing upwards. The quadratus lumborum, the lat is stronger on that side. Your internal and external obliques are stronger on that side. It's going to want to pull the hip up and lean the rib in. Likewise, if you have a tendency to rotate away from the hip, like we explained earlier, you're going to want to rotate away. So let's put this into practical application and get into that front plank and learn what I'm talking about to avoid these mistakes. I'm ready to do my front plank, but I'm keeping in mind my natural tendencies to make a mechanical error with my body. If I've identified that my pelvis likes to twist to the right, let's say, before I get into my front plank position, as I first get into it, I'm going to emphasize a little bit more of a tension to the left-hand side. Now again, that may not be a huge motion, but it may be as simple as a quarter or an eighth of an inch tension or holding my body to the left so that I'm waking up my opposite muscles on the other side to hold myself in symmetry. Then when I do my front plank, I'm going to be performing it correctly for my spondylolisthesis to avoid that excessive buildup of tension on one side so that I'm not strengthening my compression on that side. I'm not irritating the disc and the facet joint on that side. I'm not overstretching muscles and tendons and ligaments and facet capsules and disc fibers on the other side. I want symmetry after all because that's the greatest way for me to decrease the mechanical loads on my spondylolisthesis vertebra and spinal segment. I'm also going to be looking for hip hiking. If I've noticed, let's say for this example, that my right hip likes to swing up more than my left hip, and I have a tendency to lean more with my upper body to the right, as I'm holding my plank, I'm going to be thinking about opening that side up. Lastly, what I'm going to be demonstrating is, as opposed to a normal front plank that people do, if you have spondylo, it's good to do an accentuated abdominal dominant front plank where I emphasize a little bit more tail under or posterior pelvic tilt and a little more crunch down. So I take that arch and I decrease it a little bit more because if I'm a person with spondylolisthesis that's aggravated with extension, which many people are, meaning leaning back, or I want to avoid aggravating myself in extension by accentuating flexion or that posterior pelvic tilt and crunch. So that's going to take me a little bit higher with my lower back as opposed to, for instance, the top of a push-up position. So let's see what this looks like. I'll get myself set in a typical front plank position, but here I'm going to emphasize keeping my right hip down. So that may mean I want to push my right leg or scoot my right foot maybe an eighth of an inch longer than my left. That's going to help me keep my right hip down if that's my problem side. I'm going to maybe make sure that my right hand comes up slightly, maybe an eighth of an inch further up compared to my left to help keep my rib cage up on that side. And of course, I'm going to be using my muscles on my left side to contract to help keep that right side open. If I have a tendency to rotate my hips to the right, for instance, I want to turn my pubic bone slightly to the left, so there's a slight twist. Now I'm in that better front plank position, avoiding my typical dysfunctional asymmetrical forces. Lastly, I'm going to emphasize, by keeping my knees soft and slightly bent, a little tail under and a little crunch down. That's different than a typical front plank position. If you notice, I have a little bit of an uplift in my lower back, and I'm going to really feel my abdominals working so much more than if I just held a straight position. After all, you're doing a front plank to accentuate abdominal development. So why not emphasize it with a little tail under and crunch down to really highlight that abdominal contraction? As I hold this later in the set, you'll notice my hip is going to want to come up on the right. My ribs are going to want to come down on my right. My pelvis is going to want to twist to the right. So I have to focus more on keeping those corrections on the further I go in the set. Using these types of corrections with your spondylolisthesis training, making it a custom program for you and your unique mechanical distortions and issues and stability and movement tendencies is the best way to avoid aggravating spondylolisthesis pain. Many of my clients and patients that come in from other trainers, from other doctors, have been taught generic spondylolisthesis core exercises. Unfortunately, what they don't understand is that's one of the reasons they're still having problems with their lower back. They're actually strengthening their dysfunctional habits, their tendencies, their already asymmetrical strengths into greater and greater strength, which then places an asymmetrical force on the back and aggravates whatever soft tissue is involved in their spondylolisthesis pain. If you have enjoyed this video on spondylolisthesis exercise, feel free to subscribe to our channel. Got a lot of great videos out there to help you. Questions or comments, write in as always. I'll do my best to answer. And remember, if you're looking for a great program to figure out what your unique mechanical issues are, what are your movement tendencies, your posture issues, your asymmetries, how to identify them, how to correct them, and how to then build a sequential program from beginning to intermediate to advanced levels of rehabbing and learning self-skills to learn how to exercise with spondylolisthesis and build a stronger stability in your lower back, check out our fast-track program for spondylolisthesis available at painfreeandfit.com. As always, if you have difficulty with developing your own program or with analysis, I'm always available online for consultations to help you through Zoom to develop what's your unique analysis, what to watch out for, and how to build a program for yourself that's customized for your unique body. That information, again, is available at painfreeandfit.com. I hope this video on avoiding the typical mistakes with front planks and spondylolisthesis helps you with your chronic low back symptoms.